Welcome back to our role-based webinar series, which we have been hosting throughout 2022 and since the fall of 2021. Today, we will focus on the role of school mental health professionals in school safety efforts, which include security, emergency management, and preparedness activities. My name is Janelle Hughes, and I serve as Project Director here at the Readiness and Emergency Management for Schools Technical Assistance Center, also known as the REMS TA Center. As with all of our webinars in the series and beyond, there are a few tips for engaging with the platform and with us throughout the event. We have placed some relevant links to online resources in the web links pod. Please feel free to explore these web pages and also share them with your colleagues and network. We also welcome you to pose any questions via the Q&A pod or communicate any technical difficulties that you experience. We will be answering questions following the presentation and as time permits. As a reminder, we are also hosting a web chat via our community of practice directly following the event. And if you have questions that we weren't able to answer, we hope you join us there. You may also send us questions after the live event to our help desk at info@remstacenter.org. And for everyone wondering, this webinar is being recorded and will be made available in archived form on our site within 7 business days after the event. I'm so happy to introduce our guest speaker for today. Ms. Denise Reamer has a master's degree in social work from the University of Southern Mississippi in Hattiesburg, Mississippi, and a bachelor's degree in English and history from Louisiana State University. Ms. Reamer has 25 years of social work practice experience ranging from private outpatient therapy practice to inpatient psychiatric and substance abuse treatment services, to school social work and mental health coordination for the largest school system in Alabama. From 2003 to the present, she has worked for the Mobile County Public School System, first as a school social worker and homeless and foster care liaison, and since 2017 as the social services supervisor and mental health services coordinator for the district. In that role, Ms. Reamer is responsible for coordinating, developing, and implementing programs to facilitate and strengthen the social, emotional, and academic growth of all students by promoting equal access to educational opportunities through the elimination of barriers. She and her team of 13 social workers serve as liaisons between students, schools, families and caregivers, and the community through support, advocacy, case management, crisis intervention, and referrals to community resources. Since 2011, we have been so grateful to have Ms. Reamer working with the U.S. Department of Education's Office of Safe and Supportive Schools as a master trainer for the REMS TA Center on disaster preparedness and recovery for school systems, specifically on the topic of resilience, compassion fatigue, and self-care for educators and students. She is also presented at the National Conference for the National Association for the Education of Homeless Children and Youth on collaboration between schools and communities to remove barriers to academic success for students, and to the National Association of School Nurses on the importance of on-site mental health services in schools. She's also presented to a statewide audience at the Alabama Conference on Social Work on the subject of the educational rights of homeless students and the seamless continuum of care needed to address students' educational and mental health needs during a crisis. Previously, Ms. Reamer worked for the Mobile Infirmary Medical Center as a therapist in the psychiatric unit, where she worked with adults with chronic mental illness and substance dependence. We are so pleased to have Denise join us today and to share her input on this important topic. Let's take a look at the agenda for today's webinar. First, we'll provide an overview of the importance of collaborative planning and school emergency operations plan, also known as EOP development. Then I'll turn things over to Denise so she can provide a closer look at the role that school mental health professionals and collaboration teams can play in school safety. The REMS TA Center will then discuss how school mental health professionals can help enhance the 6-step planning process outlined in the Guide for Developing High-Quality School EOPs. A Q&A session will follow, and we hope that you submit any questions that you have during the event, and we'll answer as many as possible during the live event, and additional questions during our Community of Practice web chat directly following the webinar. We will also share some key resources to support your work. Again, you may download them via the web pod. Let's get started with the first poll question. Can you let us know whether you have heard of the REMS TA Center before today's session, and if so, in what context? Have you attended a live training, or maybe an in-person at your site, or a virtual training, such as a webinar like this, or via our virtual trainings by request program? Perhaps you've requested technical assistance, or downloaded a resource, or met us at a national conference, or in some other way. And I see we are getting some responses in, and so happy to hear that many of you have attended our virtual trainings before, as well that some have downloaded resources, as well as met us at national and live conferences. I do see that no one has responded that they've requested technical assistance. A friendly reminder that if you do need support with key topics in school safety, security, emergency management, and preparedness, you can always email us at info@remstacenter.org, and we will be happy to support you in any way that we can. So thank you, everyone, for responding to that poll question. If this is your first time meeting us, welcome. The U.S. Department of Education and its Office of Safe and Supportive Schools administers the REMS TA Center to help build the preparedness capacity, including prevention, protection, mitigation, response, and recovery efforts of schools, school districts, and institutions of higher education with their community partners at the local, state, and federal level. Again, our staff members are available via phone or email to respond to your request for technical assistance on EOP development. So consider us your friend and reach out to us when you need us. Let's get into today's discussion. Families and communities expect schools and school districts to help keep children and youth safe from threats, including crime and violence, as well as hazards like natural disasters, disease outbreaks, and hazardous materials spills, just to provide some examples. In collaboration with their community partners, schools and school districts can plan for these potential threats and hazards through the creation of an emergency operations plan, or an EOP. The school EOP describes how people, not just students, but also educators, administrators, school bus drivers, staff, and visitors, as well as property, will be protected on and off campus. EOPs also detail who is responsible for carrying out specific actions before, during, and after an emergency. They help identify the personnel, equipment, facilities, and supplies, as well as other resources that are available. And most importantly, they outline how all of those actions will be coordinated with the collaborative planning team. While school EOPs vary in their content, as they are customized according to the school building, they generally contain 3 sections. The basic plan, which provides an overview of the school's approach to emergency operations, such as training, exercises, information sharing, and collection. The functional annexes section, which presents how the school will manage common and essential functions, such as evacuation, family reunification, communications, accounting for all people, etc., all looking at it from the before, during, and after phases of an emergency. And the threat and hazard specific annexes section identifies protocols that schools will follow to address specific emergency types, such as hurricanes, wildfires, tornadoes, food contamination, active shooter incidents, power outages, in any of those incidents with which schools might be vulnerable. School EOP should be developed by school-level emergency planning and response teams with membership from the district's core planning team. The formation of this multidisciplinary planning team is seen as step 1 of the 6-step planning process that is outlined in the Guide for Developing High-Quality School Emergency Operations Plans, known as the School Guide, as well as the role of districts in developing high-quality school emergency operations plans, known as the district guide. These guides may be used by core planning teams to not only create new plans, but to also revise and update existing plans. We encourage you to access the at-a-glance versions from the web links pod or by visiting their MTA Center website and clicking the guidance tab. So why collaborate? Because the planning and development of a school EOP both require the expertise of a diverse group of people so that it reflects the diverse needs of the entire school community. Everyone has expertise to contribute, including teachers, school facility managers, information technology specialists, families and caregivers, nurses, psychologists, community engagement specialists, school administrators, and of course, our mental health professionals and collaboration team, which is why we are here today. Before I turn things over to Ms. Raymer, we'd like to check with our audience to get additional feedback via a poll. We would love to learn more about the role that you play in school safety, security, emergency management, and preparedness within your school or school district. So we're going to pull another poll over right now and let us know a little bit about the role that you play, whether that's supporting emergency operations plan development, looking at incident response, perhaps training or exercises, recovery, or in any other way. Thank you, and I see we have some responses coming in, and we have a very good mix so far, a pretty even mix of representation. So we have some individuals who support emergency operations plan development, others incident response, some training and exercises. It's very important to have, again, that multidisciplinary planning team. And so we are so happy that you all were able to join us today, and we look forward to receiving your questions. We really appreciate you participating in the polls. Give us that sense of who is joining from the field. Thank you. So with that foundation of the importance of collaborative planning, as well as information on how school mental health professionals support these concepts, our guest presenter will now provide us with a closer look at the role of school mental health professionals in school safety. I'm so happy to turn things over now to Denise.
Hey, everyone. Good morning or good afternoon, depending on where you are. As Janelle so wonderfully said in my bio, this is something that I've been doing for quite some time. This is actually my 21st school year with Mobile County Public Schools, and it's been a journey for sure to kind of come to this point, especially in this last 2 years after the crisis that we all have been experiencing. And I don't know if you guys are seeing that in your school systems, but we certainly are, just an increase in those mental health needs of our students and our staff and our community. And so I think this is a really important piece of that emergency operations plan. And so I'm just going to kind of go over some things that I do here in our district, and also maybe get you to put in the chat some of the things that you guys are working on. And if you have any questions, as Janelle said, you can put those in the chat and we can get to those later. But for us in our district, we have about 53,000 students over 90 different schools. And it's difficult when you have kind of urban, suburban, and very rural all in your district. We're a countywide school system, to come up with that plan that is going to be foolproof, right? And so one of the things I want to say about your emergency operations plan and about this this multidisciplinary team that you need to have this part of your plan, this mental health focused part of your plan, is that it may continually change. Just like any good emergency operations plan, it is not a static document, right? It is something that you continue to revise depending upon the things that are happening in your district. So these are some of the things that we do in our district as the mental health professionals. We have school psychologists who are mostly focused on testing. We don't have very many of them. We mostly have our local school-based counselors who are usually, have a master's in educational counseling. Some of them are licensed mental health professionals. We also have licensed social workers, and then we have contracted on-site mental health providers in our school systems. So some of the crisis intervention and then those evidence-based social and emotional interventions that we are beginning to do in our schools so that we can teach teachers what those trauma reactions look like, right? So a lot of times teachers will say to me when we're doing trainings, well, I just thought that they were being, we have all these different acronyms out there, right? We have ADD and ADHD. And sometimes my teachers say, I thought they were just, BAD, right? They just thought it was bad behavior. And so what we're trying to do is start teaching them some of those trauma-based, those trauma reactions, and then also some trauma-informed solutions for their classrooms, like having those calming corners and things like that. One of the things that we do a lot is we monitor student progress, and when we look at attendance, grades, and discipline, those are kind of our 3 indicators that we look at to see if a student is needing more assistance. And the reason we look at those is because we found that those are pretty good indicators of when a student is having trouble. Maybe they're having trouble in school settings. Maybe they're having trouble in their community, in their neighborhood with youth violence. Maybe they're having trouble at home with domestic violence or abuse of some kind. So those are kind of how we monitor that student progress. We look at those indicators, and we go there in our multi-tiered system of support, and I'll get to that later. So we also provide consultation to staff, teams, and families, not only through our social workers, but through our on-site licensed mental health professionals can go in and do classroom observations, for example, if there's something going on in a particular classroom, or talk to teachers, and the teachers can say, well, this is what's happening in my classroom. I don't exactly know how to deal with that. So we have that licensed mental health professional who's doing that consultation at that school level, which is really getting to that front line, right? And then we also provide staff professional development. We have some contracts with our local universities who have some doctoral students in psychology and other disciplines who are doing some pilots in our elementary schools, really teaching teachers about what those trauma-informed practices should be in their classrooms. We also have youth mental health first aid and psychological first aid for schools. And we do some of that via online training, and we also do some of that in-person training now that we're all getting back to that in-person training. So I wanted to talk a little bit about barriers to care. Certainly one of the biggest things that we have seen is the number 2 check mark on this slide, which is that stigma of requesting and receiving mental health care. And we're really trying with all kinds of mental health awareness posts in our social media, and really trying to get parents and the community and the students to see that this is just another tool in their toolbox, right? It's just like learning algebra and learning, reading and writing, all of those things that we really need school to learn, right? We are also saying to them that school is that optimal setting where they can learn about those other things, how to check in with someone when they're not feeling well on a series of different domains, whether it be, environmental or social or their mental health, whatever it happens to be, that they can request and receive mental health care, and it can be a very private thing for them, but it can be something that they can do while they're there at school so that they don't have to lose instructional time, stop their school day, go somewhere else, come back, and have that gap or that interruption in their academic learning. They can kind of get it all at the same place, kind of like a one-stop shop. Here in our area, we also see this number 4 check mark, the language barrier. We have a very diverse population in our county with almost 96 languages being spoken, and so our English as a Second Language division is constantly trying to keep up with all of that. And one of the the problems that we have, and I don't know if you guys have this in your areas, is that we don't have enough counselors, licensed mental health professionals that speak all of those different languages. So a lot of times they're using those translation services in the therapy sessions, and sometimes that kind of puts people off, right? They want to talk to someone in their own language, so that's something that we are really working on, trying to cultivate and grow some mental health therapists in with other language skills. I think a lot of times too, and I noticed some of our questions that came in before the chat, before the webinar, is that sometimes there are inadequate supports for mental health services, and so you don't have enough. We are a pretty big area, and so we have about anywhere from 350 to 400,000 people in our general area. And so, as I said before, it's like a mix of urban, suburban, and rural. And so you can still get to the services, but that lack of transportation, that last one, is also a huge barrier. So what we're really trying to do when we think about our plan is look at all of these barriers and how do we address the barriers? Because it's great to make a plan, right? And you get all these people around and the table, and you've got this diverse group of folks making the plan. But if you don't take into account the barriers that are in your particular area, then that great plan is not going to get you anywhere if you don't take into account these barriers. Okay, so why do we need mental health in schools? I think we've all seen that over the last few years, this increase in the request for mental health services and the evidence of those mental health issues that are coming out in our students, in our schools, in our communities. And after the pandemic, we really want to, our mission is to facilitate and strengthen the social, emotional, and academic growth of all students by promoting that equal access, right? We want everybody, all of our students to have equal access to educational opportunities, but also mental health services and all of the social, emotional needs that they have. So we have to really struggle we have a school on a barrier island here we are on the Gulf of Mexico down in Mobile, Alabama. And so we have a school on a barrier island that is very far from any services. So when you're talking about your plan, thinking about transportation, thinking about all of those issues, really focusing on equal access is sometimes very challenging. But we also know that, if students are not able to focus, if they are emotionally dysregulated, then they're not going to be able to learn as well as they should be able to learn. And that's why we think that if the mental health services are in the schools, we have them 8 hours a day, 5 days a week. That's the best place to teach them about all of the academic subjects as well as the social and emotional. So also early detection is the key, and what we have done, one of the resources that we have put into place is an early warning system. We have actually 2 of them, and one is called LearnSafe, and you all probably have something like this in your district, but it monitors. When we went to one-to-one devices a couple of years ago in the pandemic, we had to have monitoring of those devices, and we tell the students, that's all in the information when we give the student a device, technological device, and say, here's what you're going to be using. We also say, hey, we're monitoring this. And we monitor that for self-harm, harm to others, bullying, domestic violence, violence of any kind, really. And then we get notifications, and we have those safety teams that we set up at the schools that we'll talk about a little bit later, how we get to that. But this early detection, the other thing that we do is we have an app called Rhythm, and when I'm finished, I'll put it in the chat. And it's basically an emoji-based, also age-appropriate based, early warning, early check-in. Students can do it in less than 5 minutes. And we usually tell teachers, if you can use this as a bell ringer or something to get started, like when they're getting everything settled in their class in the daytime, or if they're coming back in from recess, because a lot of things happen at recess sometimes, including those bullying behaviors, that it's a quick check-in, and it does 5 different emojis, across 5 different domains, and then they can also add a note to their teacher. The teacher then gets with the counselor if there's something that is a risk alert. We set our risk alerts for self-harm, harm to others, domestic violence, bullying, all of those things that I just mentioned. And then the counselor gets involved and then initiates services from there. So we know that 1 in 5 children will be diagnosed with a mental health issue, usually during childhood. And we know also that talking about mental health and allowing for those conversations to happen in a normal setting really reduces and decreases that stigma. Certainly, one of the things that teachers say to me all the time is that they don't know what to do, right? They are educators and they weren't prepared for this. And that's often very true, although we are trying to talk to our universities here who train teachers to say you need to put some of this into your curriculum so that teachers will feel more prepared when they come out of that educational setting to go into their first classroom. So we do like to do some training for staff, so as I said before, to help them identify and respond to those mental health issues in an appropriate way that's not going to make it worse. So as I mentioned before, this is our 10th year of a comprehensive school-based mental health program, and our Department of Mental Health for the state of Alabama and our Department of Education at the state level got together 10 years ago and said, we need to do something so that we can make access to mental health services easier and better and more efficient and all those great words that we always use. And so we had an MOU, or your folks may call it a contract in your district, between those 2 agencies, between our community mental health provider and our school district. And then we contract basically with them to provide therapists in the school setting. And usually in our setting, we have, as I said, we have 91 schools, and we're not there yet. We don't have all of our schools covered, but we have about 78 of our schools covered by licensed mental health professionals on that contractual basis through this comprehensive school-based program. And so they become, those school-based therapists become a part of that school, right? They become like another counselor or another administrator, but they have that license behind them. They also meet with their supervisors regularly. Their supervisors meet with us regularly to make sure that we are providing those on-site therapy services and any other consultation or psychoeducational groups and services to those students at the schools. That mental health collaboration team, as Janelle mentioned earlier, you certainly want it to involve a variety of different people from different perspectives. And these are just some of the folks that we involve in our school team, our mental health collaboration team. The other thing that I think is extremely important, and we try to do as many times as we can during the month, is meet with our community partners. And so we also have MOUs and contracts with our DA's office and our law enforcement providers, different jurisdictions that we have. I think we have 4 different jurisdictions in our county that we deal with. And we have an organization called Project Thrive. And what it is trying to do is make us become a trauma-informed community. And so that Project Thrive is a community organization that has all of the mental health agencies in our county, all of the school districts in our county, all the law enforcement folks, and then any other like faith-based organizations or any other community agencies that are offering services so that we're all on the same page. It also involves our university hospital, physicians, and anybody else that wants to join that is providing a service to people, especially trying to reduce trauma. So we are basing that off of, there's a city in Florida that is considered a trauma-informed city, and so we're kind of trying to base it off of that. So we have monthly meetings with them just to make sure that we're all on the same page. We also, with the DA's office and the juvenile probation officers and the law enforcement and our SROs, our school resource officers, we have a multidisciplinary treatment, kind of a treatment team meeting every 2 weeks. And so what we do there is we take those students who need that additional help. Again, we look at attendance, grades, and discipline and anything else that might have come up if it was a school risk screening where they had some self-harm or harm to others or bullying. Then we look at those indicators and we bring that before that multidisciplinary team to say, let's reach out to the family. Let's see what kind of resources we can put into this family to see what's going on and to see if we can alter the course and get this student and this family back on track. So this is part of our mental health collaboration team in the community side. So one of the things that we do, our intervention team, we certainly want to we want to avoid overlap and duplication of services. So in our school-based mental health partnership, we have our licensed mental health therapists, and we also have some licensed substance abuse therapists. And so the substance abuse folks have a little bit different role, and they can only see ages 12 and up. And then our mental health therapists usually serve our elementary and middle schools, and then our substance abuse folks serve our middle and high schools, like from 7th grade up, so that we don't duplicate services. We find that if we meet with them once monthly, that school-based mental health team meets once monthly to make sure that we are looking at those caseloads, no one's overloaded, that we're not duplicating services, and that we are accessing as many resources as we can through that collaboration and promoting that open communication in those various perspectives. One of the things that we have found too that we have added on in the last couple of years is a contract with our adolescent hospital, who provides a mental health kind of a day treatment school, and we have expanded the beds for that so that we can give those folks who are, those students who are not doing well in that regular classroom setting and need a more intensive mental health treatment, they can get their education and their mental health treatment through that day treatment school. I talked to you earlier about that MTSS, or that those multiple tiers of support, and that's what we do on the state level. This is what they're looking at. So we want to provide that in Tier 1. We provide those services to all of our students in the school. So that was that Rhythm app that I mentioned to you, where we're giving, not only are students checking in through that app, but depending upon what they say and how they're feeling, that app launches an intervention that is evidence-based through CASEL. And that is the social and emotional learning, kind of the national organization that looks at all of those evidence-based interventions. So we provide that primary intervention and prevention service to all of the students in our district. Then for those who need that moderate help, they need additional help, that goes into Tier 2, so that's some of the students, and that's where we have those school-based partnerships for the mental health treatment. We have that multidisciplinary treatment team meeting, and we also have our local school counselors who have their different programs that they run for small group guidance and large group guidance. And then in Tier 3, where we address those are the smaller portion of students who have those more severe mental health issues, who are not able to maintain in that regular classroom setting. And so that's where we have that mental health day treatment. We also have, through the hospital, they provide any screenings, suicide and screenings, or self-harm or harm to others screenings when we have that occur at a school. And they do that immediately, like the same day that occurs. So as some of the things that I do as a mental health coordinator is, serve as that intermediary between the school and the community mental health providers, and then our teams, our safety teams at the school, which consist of the administrators. We usually have a lead teacher, someone from our special education or special services department, our counselors, our school resource officers, our district social workers, and then our school psychologist if testing is needed. What we're trying to do is ensure that optimal communication, especially after the critical incident. I did speak with Janelle earlier. We started school this year on August the 4th, which is the earliest we've ever started. And unfortunately, within that first week, we had some critical incidents that we had to address. Was at a high school today before coming to this webinar, because we had one of our students who completed suicide, and we needed to have some additional crisis counseling for some of the students. So we were there to meet with the team to see what was needed, and the community mental health providers met us there. Certainly we want to provide that appropriate follow-up, and I'm going to talk a little bit about how we do that in just a moment. So here are just some of the possible reasons for mental health referrals, and we look at all of these as indicators, and again, that attendance, grades, and discipline. So we want to really talk up to the students about what's going on in school, home, and in their community. Unfortunately, we've had some issues related to youth violence recently, and so we have met as a community to figure out where we go from here, and that's part of that community agency team that I was talking about earlier. So advantages of mental health services in schools, I mentioned a couple of these earlier. Certainly making it more accessible. That's what we are trying to do, is make sure that mental health services are available to any student that needs that service. Certainly the parents have said to us in surveys that it's much better for them because they know that their student can get that service right there at the school. They don't have to take time off from work. The student doesn't miss school. And it's certainly a less threatening environment. That's what the parents have said to us too. I want to speak to that for just a moment. Schools are really the hub of the community, and you know that schools look to us. That community looks to us. Parents look to us, and when things are going well in the school's operating as it should, then the community kind of breathes a sigh of relief, and parents do too. And a lot of times parents will come to the school because they know that they can get help at the school, even if it's not about an educational matter. For instance, if they are having housing instability, or they don't, their child is having some mental health issues, or their car broke down. It could be something as simple as that. They know usually that they're going to have that open door at the school to get that help. So here are some of the mental health treatment services that we provide in our district. One of the things that our mental health providers do, which I love, is they do the camps and they're free of charge. So if a student has an open chart or is willing to open a chart with the mental health provider, with our community mental health folks, they will run what they call day camps during the times that school is out. So for instance, during like spring break or summer break or Christmas break, they provide a day camp, and the children are getting to experience that day camp atmosphere. So they're having fun, but they're also putting in those interventions, those social and emotional interventions into that day camp, so that the students get what they need. They're getting some mental health treatment, they're getting supervision, and then the parents are also having a safe place to bring those students. So that's one of the things that I really love that our folks do here. I mentioned some of these other ones before. Let's see, I mentioned that we do have that monthly collaboration meeting, because that's what's required in our MOU, so that we can continue that partnership. And we discuss anything that's needed to be discussed during that time, caseloads, whether they have the appropriate private space at the school to provide the mental health therapy at that school site, and if there are any other issues between their personnel and our personnel, we deal with those things at that time. And then we also talk about, are there any grants that we could write for that would enhance or improve our services, our mental health services in the school setting. I talked a little bit about professional development before, so youth mental health first aid and psychological first aid for schools, and I think that's in the web links, are two evidence-based trainings that really empower faculty and staff, anywhere from the bus driver to the cafeteria manager to the custodian to your classroom teachers, to identify, understand, and respond to children who are experiencing a mental health crisis or a substance abuse crisis. And both of these programs really encourage school personnel to provide assistance to students and families until that licensed mental health professional can get there. I want you to think about, the analogy of doing CPR until the EMTs get there. A lot of times people ask, what's your job for the school system? And I say, well, I'm kind of like a mental health EMT. So that kind of gives them a visual, and this will too if you use one of these different professional development methods. One of the things, psychological first aid for schools is a little faster. It's a quicker training. The youth mental health first aid is an 8-hour training, and it's often difficult to get those frontline teachers and other faculty and staff in a setting for that long to do that professional development. Still a great training though. So I talked to you a little bit about social emotional learning, that trauma-informed care, and those early warning programs. I gave you an example of two of those that we are using. And then, of course, that, confidentiality is the cornerstone of providing mental health services in schools. A lot of times students will say and parents will say, well, I don't want my child to be stigmatized. I don't want them to be called out. And really we find that in providing those mental health services in that school setting, they're not really leaving the school environment. So they can say, the licensed mental health professional usually pulls them during elective class and or before lunch or, during part of their lunch, so that it's not as evident that they are going to see the counselor. But also our counselors are working on, our licensed mental health therapists, I should say, are working on talking to students about receiving mental health care, because the more we have that conversation and the more normal and regular and typical it is, all those words that we like to use, the more typical it is for everybody to be getting those services, then that reduces that stigma. This is how our mental health referral process works. For that school-based mental health collaboration, of course, we use our counselor as our gatekeeper, and we contact the parent or guardian. In the state of Alabama, it's age 14 and up, can consent for their mental health care. But we always do inform the parent. If possible, if there's an issue with the parent, then we do have to have a kind of a collaboration meeting to decide how we're going to go forward on that. The intake is usually conducted by that mental health therapist at the school before the services can be initiated, and the parent signs the forms at that time. And then certainly in the aftermath of that critical incident, as I explained to you this morning, that's where I was as the mental health coordinator and the supervisor of guidance counselors. We kind of come together to see what's needed in the aftermath of that critical incident. We talked again about the after a crisis. We have an age-appropriate safety protocol that counselors, nurses, administrators, and social workers are trained on, and they will institute that protocol if a student shares that they are feeling thoughts of self-harm or harm to others. After the student comes back from either the mental health day school or a treatment setting of some sort, whether it's an inpatient, a partial hospital program, or other kind of program where they are out for a few days, then we do always have a student safety conference with the administrator, with the local counselor, with the school-based therapist, and the student and the parent, so that we can make a plan for check-ins for that student if they start on a regular basis, so that if they have that critical incident for themselves, or that we have a death of a student, death of a faculty member, we have the ability to have those regular check-ins for that student. Oh, sorry about that. I think that's the end of my presentation, and thank you all so much for allowing me to speak about this today, and I'm going to turn it back over to Janelle.
Thank you so much, Denise, for sharing so many thoughtful considerations for schools and their partners as they look to incorporate school mental health professionals or integrate them more comprehensively. Now let's spend a little time walking through how school mental health professionals can help enhance the 6-step planning process. As mentioned earlier, the most comprehensive and effective school EOP is developed by a multidisciplinary planning team, which adds value to the breadth, depth, and scope of the plan. And Denise highlighted the important role that the team can play in supporting prevention, protection, mitigation, response, and recovery in the event of a variety of incidents. In step 2, the planning team identifies hazards and threats unique to the school community and then prioritizes them. Assessments such as site assessments, capacity assessments, culture and climate assessments, and behavioral threat assessments are all important sources of information. And members of the mental health collaboration team may lead or serve as a member of various assessment teams, including those responsible for creating and administering those assessments. And capacity assessments can help capture the resources available and staff capabilities, such as those with training in psychological first aid and trauma-informed care, which Denise mentioned earlier. Culture and climate assessments help collect students and staff members' perceptions of their safety. And I think it's very important to include mental health professionals as a part of those assessments also. And behavioral threat assessments help introduce a fact-based and investigative and analytical approach that focuses on whether a particular student, what they're doing and saying, and whether really emphasizing the importance of behavior and communications for identifying, evaluating, and reducing the risk posed by a student who may be thinking about or planning a school-based attack. And Denise, you described a bit about some of the tools that you all use to support behavioral threat assessment. So mental health staff can really help support the creation, dissemination, and analysis of information gained from those assessments. In step 3, the team then decides which threats and hazards will be addressed in the EOP, and then develops goals, objectives for each. During this work, the team may identify cross-cutting functions and develop goals and objectives for them. Members of the mental health coordination team can participate in the development of those goals and objectives. For example, looking at their role in developing before, during, and after goals. The before goal might be to ensure that there is a mechanism in place for students and staff to request mental health support, which Denise talked a little bit about. During will be the role of the mental health collaboration team or members of the team to provide psychological first aid. And then after an incident takes place, providing perhaps individualized mental health services to students and staff in the ways that Denise described. And then in step 4, the planning team builds upon the goals and objectives created in the previous step and assigns courses of action that address the who, what, and how for achieving those goals and objectives. And together, they form the annexes or portions of the EOP. Members of the mental health collaboration team should participate in those scenario-based planning activities to imagine the different ways that an emergency may unfold and to support the development of those related courses of action based on that. And then in step 5, the team develops a basic plan of the school EOP, formats the annexes, and reviews all sections. And of course, after the plan is approved by leadership, the team should securely share portions of it with community partners. And the mental health team can play a key role here in helping education agency leaders understand and develop protocols around information sharing so that only the information that is necessary is shared with those community partners. Finally, the planning team needs to implement the EOP, which means providing the whole school community with training and opportunities to actually practice the plan. As Denise mentioned, mental health staff should attend and maybe even lead trainings and participate and or observe those exercises that are conducted. They can help ensure that the school practices emergencies using a trauma-informed approach as well. As members of the team, they can also contribute to revisions to and maintenance of the EOP after an event, whether a real emergency incident or an exercise. This is really how planning teams can close the loop and ensure that the plan evolves to meet the needs of the community. So this is now time for our Q&A session, and thank you so much to everyone who has submitted questions throughout the webinar. We will start with one of the first questions that we have here. Denise, I'm going to turn this question to you. What
Okay.
resources or tips would you say are available for a school too small to have a fully built out mental health staff or collaboration team?
Well, I think that if you are too small to hire your own, I'm going to talk about a little bit though. I want to tell you about some resources that maybe your district could use to hire some folks. But if you do not have that, then I think reaching out to your community mental health providers and seeing if you can do a contract with those who, look at their licensure, make sure they have full licensure by the state and all of that, and then see if they can provide some of those services to you on a contractual basis. And in order to do those contracts, then what you may want to do is what we're doing. I'll tell you what we're doing. We're using Title IV funding. So I also work on Title IV coordination because it has a huge piece of prevention and support. And Title IV has a specific goal of safety and security of not only students, but safety and security for students, staff, the school building, and the community surrounding the school. So you could use that as a mechanism. We are also using ESSER funding, which is, some of you may call it ARP, or American Rescue Plan. So some of those funds that came out of the pandemic. This latest round of ARP funding is called ESSER 3. And we are using that because that from the federal government, from the U.S. Department of Education, has a specific requirement that you use a certain percentage of that for your mental health, services for students. So if you don't know who does that in your district, I would reach out to your federal programs coordinator and ask them about that, because that has to be a part of that plan, and you could use some of that funding to do that. Probably the other option would be to look and see if there are any other organizations. Sometimes there are faith-based organizations that provide counseling, but again, I would make sure that they are licensed, so that when you enter into that contract, you can have that peace of mind that you are dealing with and working with someone who has licensure through that state.
Thank you so much, Denise. Very comprehensive answer. I have another question here that I will support answering, and I welcome you to share as well, Denise. Are there any tools or resources that can help school administrators determine threat risk? I do want to make everyone aware that the REMS-TA Center offers a school behavioral threat assessment training in both a live and a virtual training format, and schools and school districts can request this training from the REMS-TA Center. So I encourage you to do so if you are representing a school or a school district. And we really walk through the basics of school behavioral threat assessments and how they can help and prevent targeted violence in schools. So really introducing participants to the various components of a behavioral threat assessment. Specialized topics also include the use of social media as well as a part of threat assessment. Denise, anything you'd like to add?
Yes, I would like to add that. So I just see it in the chat also, or the presenter Q&A, that one of our participants, I think, put in about the CSTAG model, and I was going to say that too. So we're currently working with a company called Navigate 360, and they have actually both of the models for threat assessment, both of the national models for threat assessment, which is NTAC and CSTAG. And so, and I know we're giving you a lot of acronyms, and I apologize for that. And I don't have all of it right in my head right now because we just started to work with Navigate 360, but both of those are national models that Navigate 360 puts forth, and they have a complete website that you can look at that gives you a platform. That's the word I was looking for. It gives you a platform to have a threat assessment tool to manage those threat assessments on their platform with your whole safety team. And so that's what we're looking into this year. And we also have, with threat assessments, we have a component that our State Department of Education requires, that we put in basically a report every time there's a critical incident in one of our schools, so that the state can look at those district by district to see what other resources they need to push our way to target to those threat assessments.
Thank you so much, Denise. And I see a follow-up question related to the REMS-TA Center's behavioral threat assessment training, wondering whether there is a cost to administer the training. And everything that we provide here at the REMS-TA Center is free. So that's the great thing about it. If you are interested in hosting a training, please do not hesitate to reach out to us at info@remstacenter.org. Denise, I have another question here. What are some proactive practices that we can implement within our school or school district?
For mental health services?
Yes.
Is it specific to mental health services? Okay.
Mm-hmm.
So one of the things that we are encouraging our teachers to do, and our local school guidance counselors, so the counselors that are there at the school every single day, they're our employees. They are doing some kind of some social and emotional language learning, right? They're talking to the students about what is social and emotional learning, what does that mean, what are some reactions that are that might indicate that there's been a trauma. You're talking about ACEs a little bit. They are doing all of those things we look at. There's some great resources on the REMS-TA Center website, and there are also some great resources for trauma-informed practices and social and emotional learning on the SAMHSA website. So SAMHSA.gov, there's some really great resources there. But we're really trying to begin that conversation. I think that's how we're being proactive. At the high school level, we're having some grade level meetings with those local school counselors and also the school resource officers, so that we can say, this is what, these are some of the things that we are seeing. These are some of the indicators that we look at, the grades, attendance, discipline, and just kind of giving them a forum to start talking about mental health issues in that school setting. And whether they're doing it in that small group at the elementary level, or that maybe that grade level or the homeroom, just start to provide some of those social and emotional learning, I want to call them vocabulary, so that they know what to look for and what to talk about. Also, that Rhythm app that I mentioned has been really helpful for us in preventing that issue from becoming a self-harm threat or harm to others or a bullying situation. We've been able to use that as a proactive measure to actually reduce the number of self-harm indicators at different schools.
Thank you so much for sharing that, Denise, and thank you so much for answering all of the questions that we were able to walk through during this Q&A session. We will answer additional questions during our Community of Practice chat, which we will host directly following this webinar. We would like to extend a big thank you to Denise again for all of your expertise. You've really brought a wealth of information and discussion points to this important topic. We do have a few resources that we would like to showcase that may be used by school mental health professionals, as well as school safety leaders, planning team members, community partners, and others who have an interest or role in school emergency planning. The REMS-TA Center has produced some publications that relate to this topic, as Denise mentioned, such as a TA snapshot on 10 tips for teaching the psychological first aid model for K-12 education agencies. On our new REMS on the Air podcast, we have a series of episodes on understanding the link between social emotional learning and school safety, as well as on managing recovery through planning and partnerships. More resources can be found on our topic-specific resources pages. For example, supporting efforts to create a public health, medical, and mental health annex as a part of your EOP. We also offer some asynchronous training opportunities, including an online course on developing a bereavement and loss annex, a downloadable training package of materials on developing a recovery annex, responding to bereavement and loss, developing a self-care plan, and various archive webinars on managing memorials and anniversaries, trauma-informed care. We also have one on the role of school psychologists specifically, because I know that was a question that someone else posed as well. So we encourage you to view our webinars page to access the wealth of resources that we have. And I mentioned the REMCA Center's behavioral threat assessment training that we offer, but we also deliver our resilience strategies for educators, looking at techniques for self-care and peer support via both our live and virtual trainings by request program. So again, if you are in need of a training, please do not hesitate to reach out to us. Our trainings are free. And of course, some of our federal partners have relevant resources as well. Just this summer, the National Suicide Prevention Lifeline activated its new Lifeline number, 988. So please share this within your community, and anyone in need of immediate help for themselves or others can call or text the number to connect with a trained counselor. The Centers for Disease Control and Prevention also provides an interactive tool to help people understand their emotions in order to cope with crises and to seek help when needed. And it's really looking on finding help when you need it and preventing suicide as well. So we encourage you to check those out also. And as we've mentioned throughout this webinar, the REMCA Center is also a resource. We are only an email or phone call away. Please do not hesitate to reach out to us if you have any technical assistance requests on any aspects of emergency management planning. Thank you so much, everyone, for attending today's webinar, submitting your questions, and engaging with us throughout the event. We appreciate your participation and hope to see you again at another webinar in our series and or hear from you in the future. We will now be heading over to our community of practice to continue answering questions via the web chat. Thank you, everyone.